Okay, you cannot speak. I think my team was put on you. Okay, so now I think you can speak. You can write. So, guys, let's start the class, and I welcome you all again to this third class of biostatistics and SPSS training. So, this will be the last theory class. This will be the last theory class. After that, you will be getting 100% practice in the SPSS. This is the last theory class, so you have to be a little attentive. You have to be little, you know, uh, connecting from the last classes. But this class will be quite, different from the last classes, because in last classes we talked about, the frequency and all, and the basics of SPSS. But today, again, I mean, it's related to the epidemiology. Today's class is on epidemiology, but it is related to the statistics, because we always, consider many, types of epidemiological studies, and go for the analysis. So there are now, as we are talking about, pharmacoepidemiology, right, or epidemiology. So can someone tell me what are the study types according to pharmacoepidemiology or epidemiology? Can someone get me the study types? Yes. Yes, guys. Anyone? What are the study types? Parallel study,
Experimental,
which is
non-experimental.
prospective, retrospective, parametric, non-parametric is what? Observational, interventional, perfectly fine. Main cohort studies. Okay. How is that main cohort studies? Descriptive, analytical. Okay. Cohort studies, retrospective, prospective. There are multiple types, right? Okay. Great. So let's start the class without a delay, guys. Without a delay, let's start the class, right? So let me share my screen. Yes, and I expect everyone to be on silent, not to, speak, right? So let's start, guys. I'm starting, so you can see the. I hope you can, guys, see the full screen. Can you guys see the full screen? Just confirm.
Yes, sir.
Great. Thank you. Thank you. Thank you very much, guys. Okay, so today we'll be talking about epidemiology. Okay, let's talk about epidemiology. So, epidemiology, I'll not take much time here. I'll be taking much time on the things which are very important. So, epidemiology is the study of distribution and determinants of the health related states or events in a specified population, and the application of this study to control the health problems. Okay, but very technical. But I'll not keep it technical. I'll just tell you what exactly the things are. One thing remember distribution, other things you remember determinants. Okay, distribution and determinants. And the third thing is very important, which is specified populations. Okay, there are three things. So epidemiology is nothing but the the people's study. Okay, the people's study, we call it the people's study. Okay, people's study, or we can say the study of people. Okay, study of people, study on people, same thing, you know. So whenever we include all type of human beings and do the larger research on them, that comes under the epidemiology. So epidemiology is made of three Greek words: epi, demos, logos. Okay, so epi means among, demos means people, and logos means study. Okay, the meaning in the English is the studies among people, or studies or study of people, right, where we study the people, right? That is the simple, when we break down the epi, demos, logos, or epidemiology in the Greek. But now my major concern here is, let's come back to the definition. Epidemiology is the study of distribution and determinants of a specified population. What exactly is the specified population? Let me give you the example so you can understand easily, right? You can understand it very easily. Suppose there is, you know like COVID-19, right? COVID-19 was there, and it was everywhere in India, China, America, Australia, everywhere, right? Or at the bigger level, Asia, America, or Mediterranean, Africa, all the continents. So we have separate populations in every continent, every country. We have separate population. Okay, we have specified population. Like maybe we can say that race is different geographically. The people are different, gender difference, age difference. There are, you can define your population into different things, right? But when we come to the epidemiological studies, we think on the larger level. Larger level means what? Larger level means, okay, the communities, the entire village, the entire city, the entire entire what we say, the district, entire state, entire country, entire continent. So we look at the different larger aspects, okay, larger aspects. But we always have the specified population. Like in the COVID-19, we had all the population, but when we talk about the complications of COVID-19, so we will take all the population which had the COVID-19, and then we will look forward for the complications of COVID-19 in that population, right? If I say the population of diabetes in the in a village, how many are diabetic? So we are looking for the specific population like diabetes, specific population, or specific event or health related states. Health related states means the disease in the population, disease or event. We can say the COVID-19 was the event, right? And diabetes is the problem, or hypertension is the problem, heart attacks are the event, the new onset things, right? So any specific disease in the specified larger level of population, if we study that, that is called as epidemiology. But nothing, like it is very simple thing, but the complication comes when we talk about the epidemiology is because it is a little bigger than what we are just thinking, like study in the specified population. But study for what? Study of what? Study of distribution and determinants. Two things you remember. First thing I'll describe here, distribution. Okay. When we talk about distribution, I was giving the example of COVID-19. Guys, try to understand. Very simple. COVID-19. Now, if I distribute COVID-19 in male, female, what's the prevalence? COVID-19 in older people, elderly people, young people, right? And in kids, right? If I say COVID-19 in healthy people and people who were having the health related problems before, so you can just distribute your population into multiple aspects, multiple, categories, and that is also called as stratification. Okay, that is also called as stratification. Stratification of the population. We usually use this word in the studies. We stratify our population into different terms, different, based on different things like gender, age, or maybe the location, maybe the, the continents, maybe the village, caste, educated, non-educated. Lot of things are there. Okay. So epidemiology means we are studying the distribution and then determinants. Determinants is one of the major factor, guys, because without determinant, without determinant, there will be no disease. Okay, without determinant there will be no disease or no event. Determinant means the cause or the reason. Or if we talk about, if you talk in pharmacy and medical language, etiology. Etiology, right? So determinant means we are talking about, now look at the complete definition of epidemiology. We are looking about, or we are studying a specific population related to a specific disease, and diseases, distribution and determinants, the causative agents, cause of the disease, and how it is distributing into the different levels of the population, whether gender, age, whatever is there, right? So three things you have to remember here. First is specified population with the event or the disease, then the distribution, and then the determinants. So epidemiology is the study of the distribution and determinants of health related states or event in the specified population. And why we do the study? Why we do the epidemiological studies? We just don't want to know. We just don't want to know the reason. We just don't want to know like the prevalence or incidence, how many people are having this disease, how many people are belonging to this category or what. We want to know the problem, and then the best part, we have to look for the solutions, right? So how to control it, how to solve the problem, how to resolve the problem, how to get down the disease, right? I like we came up with the vaccine, we knew about the COVID-19, then we thought about how it is spreading, what are the reason, how it make up, I mean, genetic things, and all. We studied everything under the epidemiological part, and then immediately we came up with what? We came up with the vaccine. So now, guys, can someone tell me here, the people who study the epidemiology are called as what? The people who learn or who work on the epidemiological studies are called what? Yes, guys, epidemiologist. Okay, perfectly fine, simple answer, epidemiologist. But we have some more terms for these people, guys. That's what my concern is. We have some more terms for the epidemiologist, or the people who studies the epidemiology. There is another term for the epidemiology also. The synonym of epidemiology is something else also. Yes, there are two. Anyone? Anyone? Okay, first thing is, careful, guys. And second thing is, understand that. First thing is community, not case control, community studies. And the second thing is public health studies or public health. Okay, public health studies are coming under the epidemiology, and these are the other synonym. If I tell, these are the other synonym for the epidemiology. Okay, so community scientist or the public health officers or public health scientists are also the people who work in the epidemiology. I mean, anyways, anyone can work, but specified people for epidemiology and public health and community scientist, or whatever we say in the different terms. Now, guys, one more question out of the box for all of you is, question here is, what is the organization in India works for epidemiological studies? I mean, on the government level, what is the government organization? Yes, guys. ICMR, WHO, ICMR. Wow. Oh, I mean, people know the answer here. Lovely, lovely. NIE is what? National Institute of Epidemiology. Okay. ICMR, NIE. INIE is the part of ICMR. Okay. Fantastic, fantastic, guys, fantastic. But on the global, I mean, on the national level, we don't have ICMR thing. Okay, ICMR does such studies, but the major institute or major organization, Indian organization, which works in the epidemiology or public health study is, what is we call it? PHFI. Okay, this is the Institute, Government of India Institute. There are 7 centers, 7 institutes in India for PHFI. Okay, PHFI and ICMR collaboratively work on that, but PHFI is the major stakeholder for epidemiological and public health studies. Can anyone tell me what is PHFI full form? Public Health Foundation of India. PHFI is Public Health Foundation of India. PHFI, remember that. That's what I asked this question to you guys. That's how, I knew that you don't know. Okay, I knew that you don't know this. That's why I asked this question to you. PHFI is Public Health Foundation of India. Okay, NCDC is for NCDC is a part, is the institute under ICMR and PHFI. Okay, PHFI is the autonomous institutes like is autonomous institute like ICMR, autonomous organization of government of India like ICMR. It deals with all public health and epidemiological studies. You know, who did all the COVID studies in India along with ICMR. ICMR was just fixing the guidelines. ICMR was looking at the clinical part, but all the public health epidemiological studies were done by PHFI. Understand that? You should know this. PHFI, Public Health Foundation of India. Okay. Now let's go next. So how did the epidemiology came into existence? So first in 1813 to 1858, the first term epidemiology came by John Snow. Okay, he was the person who traced in 1854 who traced the cholera outbreak in Soho, England. Okay, he was the British epidemiologist or British clinician actually. He was the British clinician, okay, British physician if I say, and he, invented, if I that's not invention, but like he traced the source of cholera outbreak in Soho, England, and then he made a map of Soho and England, and on that he showed that this is the source. Like suppose this is the England map, so he showed like looks like amoeba. He showed that okay, this is the source of cholera. Oh, and he became the first epidemiologist to do that. I mean, he became the first epidemiologist by chance because he traced and he mapped it. Okay, so why? What is epidemiology? Epidemiology is the mapping of the determinants in a specified population with specific disease, right? And their distribution. So he became the first epidemiologist. Can someone tell me, guys? Can someone tell me? Because I always believe in knowing everything. So can anyone of you tell me or write the story of like how did he do that? What's the story of 1854 cholera tracing? Can someone tell me? If you are knowing, don't Google. I'll tell you otherwise. It's a very interesting story. Yes? Anyone? No? No people? No idea. Okay. So I'll tell you. In 1854, there was cholera outbreak in Soho. I mean, in the London actually, not in the Soho only, but in entire London. Okay. This physician was the John Snow was the physician in Soho. Okay. So he, like he was seeing the patients and he got to know that this is something new happening because of, something very new. So what he did is whatever patient, whoever he was getting, he used to ask them the history. He used to ask all the history, the detailed history. Where did you eat? What did you eat? What did you drink? From where did you drink? So the people who were coming to him had the water from one pump, hand pump. Okay, they all had the water from one specific hand pump in Soho. Okay, and that hand pump was like just parallel to the sewer, the gutter, okay, which was connected to the river, the small river, we can say river, which was going through entire London. Okay, so whoever the patient came to him, like someone from here, this area, someone from this area, someone from this area, someone from this area, someone from this area, 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 and then he connected everything like they all at one instant in their, I mean, at that period, they drank the water from this. They had the water from this pump, this hand pump. Okay, so that's how he traced the source of cholera. And then they found like it is cholera, and cholera is coming from this hand pump. And then they went into the deeper history of that, and this was just parallel to the sewer or the gutter. Okay, and that gutter was connected to this river, and this was spreaded, through that river and through that gutter and through, like that's how it was spreading in the London. And then they, he became the first epidemiologist, or first doctor, or first scientist who came up with this idea. And then they stopped the entire water. Okay, they stopped the entire water, and they announced that nobody will be drinking the water from such hand pumps or such facilities where these are connected to such sewers or hand pump. Yeah, water from the pump. I mean, in 1854, the England was so developed that they had hand pumps. Okay, yeah, that is the three almost 250 or 270, not 270, but 170 years back, right? 170 years back, this story was, right? So he became the first epidemiologist. Now, as I told, the epidemiology is the study of distribution, like how we are distributing and determinants and the frequencies. Frequencies means definitely if we are talking about the disease in a population, then we all talk about how much it is, right? How much it is and how many people are affected. That is incidences and prevalences, right? Incidences and prevalences are the frequency. So there are three major components for, as I told you, there are three major components are population. So frequency of the population, distribution, and determinants. Okay. So measurement of frequency of the disease, disability, or death. I mean, see, frequency of what? Frequency of the disease in the population, or maybe the death or disability. We say, na, like you have heard of birth rate. Birth rate is frequency. Death rate is frequency. Rate of disease is frequency. So there are multiple things, prevalence rate and incidence rate, death rate. These all are the part of frequency. These all are the part of epidemiological components. Okay, these all are the part of epidemiological components. Now, comparing the disease frequency in different population. I mean that, as I told you, distribution in different genders, different age groups, and all, right? Now, here is the main crux of this presentation today. So, epidemiological studies, guys, focus now. You have to understand this, everyone. Like, what are the types of studies usually you do in the hospital and in the communities? So, the study types, right? How we define the study types. Epidemiological study means all the studies are epidemiological, whether they are hospital based or community based. Okay, epidemiology now covers the hospital based studies also, right? So either those are hospital based or community based. Both are epidemiological studies. So how to, you know, define and divide the studies. So how to? You have to remember these three things. First thing is, did the investigator, INVG is investigator. Okay, did investigator assign the exposure? Okay, did investigator assign the exposure? Exposure means here is like any kind of risk factor, intervention, drug, or whatever is there. If it is done by investigator, okay, if it is done by investigator, then the study type will be experimental, because the investigator wants to experiment. Investigator wants to test either the risk factor or whatever, the drug, the counseling, whatever type of things. The exposure, they have given the term exposure, exactly that's not the exposure, but that could be the intervention. Okay, that could be the any type of intervention. If the intervention is assigned by investigator, then it is experimental. Okay, if the investigator has not assigned any kind of intervention and investigator is just observing, just trying to collect everything, trying to oversee everything, but he did not do anything, he did not put the intervention, but he is just looking at everything, right? So that is called as observational studies. If the investigator assigns some kind of exposure or intervention, that is experimental studies. If not, then observational studies. There are two type of you know there are two types of the major studies. One is observational, one is experimental, right? Experimental, again, based on the communities, like in the COVID, we have seen a lot of community trials, and then the clinical trials, hospital based clinical trials, and community-based clinical trials. Okay, these are the experimental. There are multiple things, to understand binding, non-binding. Okay, and then the arms, parallel arms, clinical trials, randomized control clinical trials. Oh, that I'm not going there. But all the clinical trials come under the experimental type of studies, because those are experiments. Those have some kind of intervention. Okay. Now I'll come to the observational studies. Observational studies are also two types, guys. Observational studies are also two types. Let me delete this and then I'll show you full thing. So observational studies are also two types. One is if you have any comparative group in the study, if you have the comparative group, if you don't have the comparative. Okay, if you have a group of comparison, like group to compare, like maybe A versus, A versus B, or, drug X versus Y, or whatever, maybe the normal current therapy versus yoga. Okay, I mean, whatever is there, but that is not given by the investigator. You are just observing the natural process. Okay, you are comparing the two things. You are comparing the two things here. So if you have the comparison group, then you will go to the analytical type of studies. And if you don't have the comparison group, you will go to the descriptive type of studies, because you don't have anything to compare. You don't have anything to compare, so you will go to the descriptive studies. Descriptive studies are like case report with one case, only one case. You will be analyzing the entire case. You don't need to compare anything. You are just putting everything about the case, like what are the investigation, hospitalization, drugs, interventions, whatever was given, like procedures, whatever was done, it is only for one case, right? So you are writing the case report. Then case series, more than two cases, more, I mean, two or more cases are coming under the case series, but similar type of cases, more than one similar type of cases comes under the case series. Here also you are not having any compare group. Okay, you don't need the comparison. You're just describing the data. Then there is cross-sectional studies. Cross-sectional studies also do not have specific comparative group. That is like you are, first of all, let me tell you like what is cross-sectional studies. Cross-sectional studies are being done within a timeline, with one objective, that is like to understand the frequency of the disease, frequency of anything, whatever, there is related to the frequencies. There is related to the frequencies. Case control, I mean, cross-sectional studies. Cross-sectional studies are small studies, may be done within 1 month, 2 months, 6 months, not more than 1 year. But that 1 year is not, to do the entire study. But there you are collecting the data, you are analyzing the data, you are just showing at a point of time. The limited point of time is cross-sectional studies. You don't have the big time. You are collecting all the data and representing the results. In the cross-sectional studies are very limited type of studies. Okay, cross-sectional studies means on, I mean, in one point of time you are doing a study. One point of time could be 1 month, 6 months, 1 year, but not more than 1 year usually in cross-sectional studies. Okay, and those you can take, I mean, that I'll not go to the deep, right? Cross-sectional studies I'll take sometimes else when we are talking about epidemiology. So cross-sectional studies. Okay, now if you come to the analytical studies, analytical studies are also divided in two types based on the direction. Based on the direction. Okay, so what is the direction now here? See, you will see two terms here. One is XP, one is outcome. So the XP is nothing but exposure. Exposure is nothing but what? The reason or cause. Okay, and outcome is like the final disease, final outcome, like disease. I'll give you an example here. You will understand what is outcome and what is exposure. Suppose smoking, okay, and lung cancer. So smoking is exposure, and then people got the lung cancer. Lung cancer is outcome. Okay, lung cancer is outcome. High sodium intake, high sodium intake, raised blood pressure, you know, raised BP. Raised BP is outcome. High Na intake, high sodium intake is what? Exposure, right? So now you understand what is exposure and what is the outcome, right? So direction we are talking about. Suppose we want to do a study in smokers. Guys, try to understand, focus here. We want to do a study in smokers, right? And we want to check when, like, within 5 years, how many are getting lung cancer, right? How many are getting lung cancer? So now focus here, direction. So we are at this point of 2024. This is now, we are going forward, the direction is forward direction. And in 2029 we will analyze our whatever sample size, 1000, 10,000, whatever number is there, we are not going to that. In those patients, in those community, like a village, maybe a village, a city, a, whatever number, or 100, whatever number you have, in 2029, 2029, Vijay. Okay, so in 2029 you will be seeing how many of this population got lung cancer, right? So these type of studies are forward, or the forward direction studies. As you can see here, exposure to outcome. We have exposure, we are going to outcome, we are going to get the outcome. Like if I want to know, anything you can take, alcohol consumption, and then heart attacks. Okay, heart attacks, or whatever, like, so these are forward direction studies, and forward direction studies are called as cohort. Okay, but cohort is not only the forward direction, but cohort has one more very important, very important, characteristic. That is, like, all the cohort studies have some similar characteristics. Okay, similar characteristics means, and how did this cohort word came into the scenario, guys? How this cohort word came into the scenario? Cohort means the similar. Cohort means similar. Okay, cohort means the similar, right? Maybe these all the patients have similar date of birth, similar height, similar weight, similar gender, similar what, similar disease, similar exposure. Whatever is there whatever is there you will be looking for, the similar type of population. And how this cohort has come into the market? Cohort exactly is a word for similar. Okay, similar. And why it came, again, in the England, the Elizabeth was who? Elizabeth was queen. Elizabeth first was there. So there is a security team. There is a security team for Elizabeth one. Elizabeth first, there was a security team. Okay. So there was the eligibility to come into that security team is that everyone who is more than 6 feet, and they had some physical parameters also, like weight category from 60 to 70 only. Okay, and height is 6 feet minimum, and then physique, then BMI. I mean, everything was perfectly measured, and they should match this criteria. They should match this criteria. Everyone will be coming under this criteria, the security team. So that security, group was called as cohort. Cohort means they are similar. They are similar. Cohort does not mean that they were, the security team or something. Cohort means they had the similar characteristics. So that's how the cohort studies came, right? And the direction is exposure to outcome. Exposure to outcome, right, guys? Now, one more important thing I want to say here is, see, exposure does not only mean the reason. Okay, exposure, I did the cohort study for heart failure. What was my exposure and what was my outcome? My exposure was heart failure itself, heart failure patients, and I followed them up for 5 years. 5 years to look for what? To look for death. So here death was outcome and heart failure was exposure. All the patients I followed for 5 years to check how many people die in between because of heart failure, right? So your exposure could be anything, the reason for the reason for the outcome, right? So that is the forward thing, like forward direction. Then if you want to come back backward direction, that kind of studies are called as case control studies. Okay, that kind of studies are called as case control studies. Now what is backward direction? Now, as I gave you the example of smoking, right? And then lung cancer, right? Now, if you are having the population with lung cancer, right? And you do not know why the lung cancer has happened. You know the outcome. You have the outcome with you, but you don't know what is the exposure. So you will check this lung cancer population. Sorry, you will check this lung cancer population backward and look for the exposure. You will collect all the data, history, everything, and then you will run the test to know the exposure. Like what was the exposure, what was the correlated factors, maybe the age or smoking, alcohol, whatever was there, toxic exposures, whatever was there, but there was something, the exposure. I mean, we have the outcome. Now we are going back and checking for the exposure. We're going back for the exposure, right? So that kind of studies are known as case control studies. So how do we do them? Case control studies, like, so sorry, we have we have these things. We have such one, like the population, like lung cancer population, and then we will be comparing that with healthy population, right? In lung cancer, we'll be checking why it is happening with smoking, and here also, like, how many are smoker, and then we'll be comparing. That is the statistical part, I'll tell you later. Okay, so this is like the case, this is like control, right? So that the backward studies are case control studies always. Okay, these goes with the case control type of studies. Okay guys, understood anything here to make it clear? Okay, now someone is writing prospective and retrospective. Not at all. These things are not prospective. The backward direction or forward direction does not mean the prospective or retrospective. No, 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 guys. No, you are doing wrong. You are doing wrong. See, direction means, see, you can study all these things, like both the studies you can do from 24 to 2019 only. I mean, 29 only, right? Suppose the exposure is smoking, lung cancer. 29, you are getting the lung cancer. Within 5 years, you are checking how many are getting lung cancer. But you have the lung cancer, and then you want to go for smoking. You have the lung cancer patients, then you will take the healthy patients and you will follow them for years and then check, like, what exactly was the reason. Maybe the years, or sometimes, but usually, in that we collect the older data, not the newer data. We collect the older data, not the newer data. And prospective and retrospective are different thing. Okay, prospective and retrospective are different thing. I'll tell you what is the difference between prospective and retrospective. So see, suppose patient A was admitted to the hospital on 28th April, and he is still admitted. Okay, still admitted. You are the researcher going to the hospital, collecting the data from the patient, collecting the data from patient. So what you are doing is you are doing a prospective study. Prospective study. See, whether you are collecting the data from medical records, you are collecting the data from, you are collecting the data directly from the patient, patient's caregiver, wherever. If the doctor, I mean, if the patient is in the hospital right now currently, this study is called as prospective study, right? But once the patient has gone the home, okay, you are just going to MRD, medical record department, and you are collecting the data from medical records, MRs. Then it is called as retrospective studies. Means you are not collecting the current data, you are collecting the old data. So prospective means the current, and retrospective means the old. Okay, see, if the patient is here and you're asking old surgeries, old medication history, medical history, that is still you are asking currently when the subject is in front of you. Okay, and you are collecting all the subjects continuously, currently. Okay, that is called as prospective studies. And when the patient gone home, you are collecting the data from the records, but not live from the, like, this is the information is not first hand. That is called as retrospective study, right? The first hand information is called as current study or current information or prospective studies. So prospective and retrospective are different things, not the forward and backward. Okay, not the forward and backward. It is like current and old. And when I was talking about the directions, that is backward and forward. Okay, any questions guys here? Any questions here? No? If you have the questions, please ask me. Okay, now I'll come to the incidence. So incidence and prevalence are two major terms for what? For the epidemiological studies. So incidences are like the new number of cases. I mean the number of new cases only. Like suppose COVID was there. COVID was there. If it like something is going on right now. Something is going on right now. I want to say, I mean COVID, suppose COVID only. So COVID is going on and I want to know how many new cases are there. New cases are there today, today only. Okay, how many new cases are there today only? Like India's population is 1.43 billion, 1.43 billion, and today there were 10,000 cases for today. That is incidence for today. And if I ask, oh, in this month, how many new cases were there? So, like, suppose 1 lakh patients were there, 1 lakh new cases were there this month out of 143 billion. So, these are the incidences. Incidence means the number of new cases, not the old cases, number of the new cases, which is defined population in the specified period of time. A specified period of time could be 1 day also, 1 month also, 1 week also, 1 year also. Okay, so within a certain period of time, the number of new cases, okay, number of new cases are known as the incidence, guys. Number of new cases are known as the incidence. Look at the example. If there are 500 new cases of AIDS in a population of 30,000 sex workers in a year from 1st Jan to 31st December, then incidence is again simple. 500 divided by 30,000 into 1,000, because we want numbers in thousands, like how much, like 16.7 per thousand per year. Similarly, we'll do for the COVID, like, okay, per thousand. Why we are counting in thousand? This is not multiplied thousand. This is like 16.7 per thousand per year. Okay, this is the unit for incidence. Okay, so facts, only new cases during the specific period of time, and we should have the population at the risk. Okay, new spells or new episode of the disease, only the new spells, not the older one. Okay, if I go to the prevalence is total cases in certain time. Like if I ask you, what is the prevalence of COVID-19 today? COVID-19 today. So you will say out of 140, estimated population at the same point of time, like 143 billion, right? So here there are like in last 1 month, 2 months, whatever, there are 1,50,000 cases are there already. 1,50,000 cases are there, and today again there are 30,000, right? So total number of cases is 1,80,000 by, I mean, divided by billion population. Okay, into 100, because it comes in the percentage, right? It always comes in the percentage. So this much is the prevalence. Prevalence means old and new cases total. Point prevalence, period prevalence. It can be also prevalence today. What is the prevalence of COVID today? What was the prevalence of COVID in 1 week, 1 year? So terms are similar, but the definition is different. Incidence means only new cases, prevalence means old and new cases, both. Okay, guys, both at the point of time under the different population. So incidence is counted in the thousand and prevalence is counted in the percentage. Okay, so this will not take, this is not for that now. Now I'll come to the one thing, 5 minutes I'll take, and then we'll go to the therapeutics class. Okay, or I'll take this tomorrow. No worries. I'll only take this tomorrow because it will take time, guys. Because it's quite big and not easy to understand. So I'll only take this. No feedback form for today, guys. Now, okay. So it's fine. I mean, we have the therapeutic class also. You guys have a lot of work to do. Okay. Yes. What is the doubt? Please tell me. Please ask. Pilot study, definitely I can tell the pilot study. Pilot studies are the shorter study to understand the feasibility of the study. Okay, feasibility of the study. Pilot studies, we do a little study to check if the actual study is feasible or not. And then we go for the complete study. Like I want to do the heart failure study, heart failure clinical trial in my hospital. But before that, I want to check like if I can do the heart failure study or not, like to check the realities, if all the facilities are there, and if the things are proper in shape, or the people are there to help me or not, how to collect the data, if my ethics committee will help me or not. So I want to know everything, and that comes under what, that comes under the pilot study. So suppose we want to do the study in 1000 patients, and before that, for 1 or 2 months or 3 months, I am just giving it try to complete that. I'm just trying to start that study in some number, some specific number only, like 30 patients, 40 patients, 50 patients, just to check the feasibility of the process. Okay, that is called pilot study. Okay, like someone wants to make the instrument, or someone wants to make a uh, helicopter, suppose, or maybe the drone. Okay, so what they will do is they will make 1 or 2 prototypes, that is also called as pilot. Okay, pilot studies, and they will try it. They will check the feasibility, if it can go high, it cannot go high, it can fly for how many hours, what kind of battery is required, what kind of operations are required. So to check the feasibility of the big study, just to check the feasibility and the resources and the process, we do a pilot study. Okay. Sir, is prospective and retrospective studies are based on time bound? No, see, it depends. Time bound is nothing. Time bound means time bound is something for the, for what? For the sample size. Like there are some sample size calculated by the statisticians with the formulas. There are some studies which are time bound. Time bound means I'll do that study for 6 months, I'll take all the patients, whatever number, maybe 10, 15, 12, 30, 40, 100, 200, 500, whatever number will come to the hospital within 6 months, I'll take that number. Okay, that is time bound. And I'll do the study, but I'll take only 100 numbers because it has come by the statistical formula, that is sample size calculation. So how much sample size you are taking, that depends, either you are calculating or you are going for the time bound studies. That is sample size, not the retrospective or prospective. Okay, both the types of things. Usually, I mean, prospective also you can do the same thing, retrospective you can do the same thing. Retrospective means whatever the patient came from January 2020 to December 2023, last 3 years, I'll take all the patients, that is time bound. If you want to, like, I will take 1500 patients, whatever time it takes, I'll take 1500 retrospective patient, that is also retrospective. So it depends. Time bound is nothing. Time bound is the sample size formula, like the technique for the sample size. Okay, Manu, can you explain about longitudinal studies and pseudo longitudinal? I'll explain these things tomorrow. Pseudo longitudinal and longitudinal tomorrow I'll explain. Okay, just similar in principle to a pilot study. Okay, got sir. Thank you. Okay, guys. So thank you very much, and I'll see you tomorrow again. I think my classes are going a little longer. I'm not, I'm taking too much time to explain, but it's okay. I think once you are understanding the base, you will be understanding the entire SPSS. Okay, I'll take one more class tomorrow, short class, 6 o'clock. Okay, guys. So thank you very much. Take care, guys. And just join for the pharmacotherapy class.